Okay. Are we on? Please don't all leave at once. Well, good morning, welcome everyone. And we're being live streamed as well, so hi for those of you online. This is the first ever MSME Day at COP, organised by the ICC. So this is a first. And what we wanted to do today was to kick off with a very informal fireside chat to get the conversation started, and no doubt it will continue through the day. What I think is very interesting, as we all know, small businesses actually make up the vast majority of businesses in the world. And they're the bedrock, really, of the global business system. But they have very little, if any, voice often when it comes to climate change. So I think today kicks off something to change that. I'm Justin D'Agostino. I'm on the executive board of the ICC. I'm also the global CEO of international law firm Herbert Smith Freehills. And we've two very inspiring leaders with us to start the conversation today. And why don't I get you to introduce yourselves? Josie.
Hello, everyone. Thank you for joining us. I'm Josie Morris. I'm Managing Director of a company called Woolcool, and we're based in the UK, in the middle of the UK. And I also sit on the ICC Small to Medium Champion, Business Champion, and also on the WTO Business Advisory Group. Very much passionate about getting the voice of SMEs out there, because as you say, they make up a good chunk of the world's economy. So really excited to be here, so thank you.
Great, thanks Josie. Elisa?
Yeah, good morning or afternoon, evening, depending on where you're streaming from. I'm Elisa. I'm responsible for sustainability at Chez, which is a software company that serves small, medium businesses. So I'm really excited to be here today because what you just said is what keeps us up at night. Small, medium businesses are the backbone of the economy. So we really need to take them with us on this journey.
And whilst they're also the backbone of the economy, they themselves contribute quite a lot to climate change, in a sense. So we're going to get into that a little bit today. And I think, got some questions we'll take from the floor, so we'll try and leave a bit of time. So let me start with you, Josie, and why don't you tell us a little bit about what you see as the opportunities and challenges for SMEs in terms of advancing sustainability objectives?
So yeah, I kind of like to think that opportunities and challenges are the same thing, because obviously if there's a challenge, there's an opportunity to do something different and to make a change. So I think the biggest challenge for SMEs is actually an example of what we're doing today, which is having a voice around the table. And I think that's the challenge of SMEs to get the message across, that because we do make up such a big percentage of the economy, we make up, thank you, because we do make up such a big percentage of the economy, that actually our voice around that table is absolutely really important. And I think the other couple of challenges I think I've seen from certainly on the boards I sit on and people who feed into it is actually around the fact that it's getting the knowledge base. As an SME, anyone who runs a business will know that you don't have a lot of time in your day. So I think it's around having that reach of the knowledge base and the places to go to find that information about sustainability and to really delve into that. And I guess the other challenge then is around financing. You know, I think sometimes people are worried that sustainability, doing things to improve sustainability, can become a cost for a business. But the actual truth is it can save you money. So if you're saving energy, it can save you money, but also you're contributing to the environment. So I think although there are those challenges, I'm a big believer in that just because something's hard doesn't mean you shouldn't do it. But I do think there's a lot of opportunities for businesses to have improvements, not just from a sustainability point of view, but from a bottom line point of view as well.
And Elisa, Sage represents thousands of small businesses, and I guess that's your day job, is supporting this part of the economy. What do you see as key efforts to spearhead the change?
Yeah, so I mean, at Sage, we are obsessed, I think it's the right word, with how can we support small, medium businesses to thrive. And so you mentioned that small, medium businesses are the backbone of the economy. We were just chatting, they're 99% of businesses globally. And you're right, you know what's the issue? That when you look at small, medium business, you believe that their emissions are small, because they're small. But if you look at them aggregate, that starts to become quite an important size of the global emissions. And we did a study last year, just in the UK, for instance, they represent about 63% of non-household emission. So I think for us that was a bit of a revelation, and from there on at Sage we are focusing on a couple of things, and those are how can we simplify the standards for small medium business and make sustainability easy to understand and access and report on, because you can't manage what you can't track, right? And the second thing is how can we use technology and digital tools to alleviate the burden, because we know very well what you described there. When you are running a small, medium business, in the morning, you are the chief people officer. By lunchtime, you are the CFO. And by evening, you're probably the same person that downloads the goods from the truck. So it is not realistic to ask the same person to suddenly also become the chief sustainability officer and climate expert that fills out endless, Excel spreadsheets with conversions factors. So we want to take that burden away at Sage, and we see technology at the heart. I'm going to close with one remark, which I think is important in the context of COP. We believe digital tools are essentials, can unlock solutions. We know that they cannot alone save the world. And therefore, these conversations today are about how can we collectively review the standards, simplify them, and make them accessible is crucial.
Wearing all these different hats, wearing your CFO hat, Josie mentioned, access to finance, access to capital. What more can governments, what more can bigger players do to solve that problem? Question one. Question two, then what are you going to do with it?
Yeah, so I think that what small, medium businesses have told us is that the two biggest barriers that they find and you'll tell me, hopefully you confirm, we served about 16,000, so we're fairly confident about the results. But they told us two are the barriers. One is the complexity of reporting frameworks. It's just impossible to navigate. Every morning they wake up, there is a new acronym they need to battle with. The second thing is access to capital and cash flow. So I think that it is very important that we do two things. One is making reporting affordable and accessible. And that's, partly on big businesses like ourselves. So we are responsible. But there is also a role for governments and policymakers around the simplifications and the incentives, as well from the financial sector around the financing facilities that small, medium businesses have. And I'm really glad that today I can see in the audience, Gavin, later on tonight we'll be partnering with the Bankers for Net Zero and Perseus and talking a bit about what's the role of also the financial services industry and what are the digital tools that can enable that data flow. Because one of the challenges that banks face, and I was in the financial sector before I joined Sage, is that tracking and measuring emissions is hard. And to provide financial facility with credibility, they do need that data.
Thanks, Elisa.
Can I just add to the challenge thing? I think, just touch upon what you were saying about government and engagement. I think one of the challenges that small businesses have particularly is around flip-flopping on policy. So 1 minute you're aiming for net zero by 2030, the next minute is 2050. And I think businesses, and I accept that we always strive for stability. Now, there's never going to be stability in the world. That's the nature of the world. But for us, I think it's around having a consistent voice with policy, because I think politically those things change, but we need to take politics out of sustainability and make it something that is a cross-party. So instead of playing politics with it, it becomes around good, honest, forward-looking leadership. And I think that's a challenge we've probably had a little bit in the UK around change of policy. And, we've been leading in many ways, but I think that flip-flopping doesn't help businesses to then, when there is a change in carbon policy or something's changed, you then have to make the change yourself. And as a small to medium business, it's having the resource and the time to do that.
The three great takeaways already, aren't there? One, simplifying the framework, the regulatory framework, the acronyms, the requirements for SMEs. Secondly, access to capital, the role of the financial institutions. And thirdly, and this is a big theme, is this point around certainty and trust of policy. Yeah. And it's very hard to operate in a system that it's uncertain and that you lack trust.
Yeah, I agree. I think it's about, people talk about certainty in business, and I always say business isn't certain, but there are certain things you can control, and it would be nice to have that. I know it's a utopian view, but it would be nice to have that more future view of, and things are evolving, things do change, but that clear leadership that we're going to be doing things for the right reasons, not for the political reasons, and I think that's the key for business.
No, that's great. We've got time for a few questions. Have we got any spare microphones? We've got two. Just the second row, stage left. Great, thank you.
Thank you, good morning. My name's Stuart Thompson. I've got two hats at the COP. It's my first COP, by the way, so I'm learning a lot. So I am working with the Confederation of Asia Pacific Chambers of Commerce and Industry, which is 26 countries in the Asia Pacific region. Our major demographic is SMEs. And also, I'm a founder and the CEO of the Good Business Foundation, which is a foundation established in 2019 to support SMEs on ESG in the Asia Pacific region. So the reports you've done have been fantastic, by the way. I just want to commend them and all the work you've done. It's been really informative and very good for us. As we've gone around talking to small and medium-sized businesses on climate especially, definitely the concern is there, which I think reflected, and there's definitely concern at all levels, whether it be Australia, Timor-Leste. But the small-sized businesses, as you've said, I agree with all the points you've made, basically just don't have the money or time or resources to take it on, despite our efforts from the foundation especially. But as we've gone up the levels, we've hit a medium-sized group, probably around the size of 200 employees, which are recognising regulations coming. One of the things that we've been finding is that when we ask them what are the major challenges you're facing beyond what you've said already, is the mindsets and skill sets of the executive especially. The boards are getting on board, but the executives are either in their 60s and going, I'm just going to see this one out, or they're younger and they're getting recruited into the bigger businesses. I'm just wondering about if you could just reflect on this sort of mindset and especially skill set of that medium-sized band in this area. Thank you.
Great question. Lisa?
Yeah, so it's interesting. So when we did our research, I mentioned the first two barriers, complexity and financing. The third place goes to skills and capacity and capability, which has been identified by small, medium businesses as one of the biggest challenges. Now, our view on this is that you need two things. You need those simplified and convergent reporting standards. It is unrealistic to ask a small, medium business to start complying with 4, 5, 6 different type of regulations. It needs to be a very simple, digestible, proportional set of reporting measures that they're asked to do. The second thing is, I believe technology can help alleviate that burden. I think that some level of upskilling is required. We're doing quite a lot. We are very happy that we're partnering with the International Chamber of Commerce, PwC. As you've seen in the report, we're starting to chip away and trying ourselves to answer the question, how do we simplify? So some level of upskilling will be required, but I also think we cannot ask small, medium businesses to suddenly add another hat of becoming chief sustainability officers. And that is where I think technology comes into the game.
And role of technology and role of bodies that you actually represent. And I guess this is where the ICC itself can play a part, representing 45 million companies in 150 countries. And actually, that was, I thought, a good place for us to end. You know, what more can we do to ensure that MSMEs have a voice on the international stage on issues such as climate? Josie?
I think it's things like this. I think from an ICC perspective and from a community perspective, anyone with a group of businesses is to shout about, not just talk about the policy around large businesses, but also to bring the SMEs and have a special day, have events, talk about SMEs separately. Because although businesses are essentially the same entities, you know, they've got the same structures, and you have you got maybe someone who's responsible for finance, sales, etc. Ultimately, the SMEs are a slightly unique animal compared to something like a bigger business. So I think really for me, it's around having more things like this and maybe some focus days. And I think when those policymakers are feeding into big business, into a government, they're not just thinking about big business, they are talking about SMEs too. And we feed that through from a policy level as well, and they are separated out in that conversation.
Can we just stay with this point for 1 minute? I don't want to put people on the spot, and we have a couple of questions in the front row. I don't want to put Wendy or anyone on the spot, but this theme about why is it important to big business, big law, big business, that they think about MSMEs? Let's come back to that. Take the question in the front row, please.
Yes, thank you for accepting my question. So my name is Adriana Rodriguez, and I'm a consultant at Climate Strategy and Partners. We've been hired by the European Climate Foundation to work on SMEs in Spain, and we've been doing this for 2 years. We published a report that we presented here with Chez last year at COP on what are the barriers and opportunities for SMEs in Spain for climate action. And what we found is that it's true that, of course, regulation is let's not say a burden, but complex for SMEs, right? Even though it's important, and regulatory changes go very slowly. So one idea that we had, and I wanted to see a bit your perspective on this, is instead of asking SMEs to respond to a regulation, let's mobilize the actors that can help them do that by building a network of stakeholders that represent pressure points for SMEs. So what we have done in Spain this year is that we have been talking to chambers of commerce, local chambers of commerce, to help their SME members calculate their carbon footprint and find ways to finance a way to reduce it, right? So here we see chambers that can, in a way, simplify with their technicians the regulation for them. Then we also have big companies, as you mentioned, that are starting to work on their supply chain and helping their SME suppliers to calculate the carbon footprint. We have examples from Iberdrola in Spain, from Telefónica, that are starting to do trainings for their SMEs, and also even creating carbon footprint calculators for their SMEs to use for free. And then we also have here very important for Sage accountants. So we found that in Spain, 77% of SMEs have at least part of their processes outsourced to accountants, and tools like Sage can be very important. So in a way, what I'm trying to ask you is, where do you see these key levers for SMEs to be mobilized through other actors that can take that regulation and simplify it? Also banks. We have been talking to banks, and they also have the tools, the resources to create these technologies and translate finance into emissions from their SME clients. So have you been seeing this kind of groundwork in your countries? Because it's what we're doing in Spain, but maybe in the UK and other countries, there's something similar going on, and that's a bit my reflection.
Wow, that sounds fantastic, what you're doing. Any observations,
Yeah,
Elisa?
so it's a very good point, and I think it links to your question of what's the role of big enterprises, right? I think you're spot on. So this is a bit obvious, but like anything with climate needs a collective effort and system change, right? So you're right, just fixing regulation won't do it. Just giving them a tool won't do it either. So, and it's interesting because in our report, so the report is global, so 16,000 small, medium businesses around the world, but we're actually starting to delve into the regional differences, because what we started to notice is that about 2/3 of small, medium businesses are experiencing pressure But depending on the geography, the pressure will be coming from different places. So, and small, medium businesses in Europe, especially, they're feeling it, especially from investors and regulator. If you go to the other side of the Atlantic, you go US, Canada, they're experiencing from a customer perspective more than regulation. So different pressures point, but I think the bottom line is yes, absolutely. And this is why our partnership with the International Chamber of Commerce is so valuable. We represent a segment of the economy, which is big enterprises, and we understand small, medium businesses, but International Chamber of Commerce has such a big reach and ability and convening power, which is the very reason why we are here today. And we want to really spark that collective actions to get all those different pieces of the puzzle together.
Can I bring Wendy and then you get the final word, Josie? Okay.
Thanks, Justin, because you called me out. Just the SME is often overlooked. The vast majority of GDP in most countries, UK, New Zealand, which I know best, but ultimately all global business, no matter how large the multinational, ultimately comes back to an SME at some point. Take Nestle. You've got the dairy farmers growing, working on the farms, owning the farm. So ultimately, if you go down the supply chain far enough, you will always end up with an SME, but you don't have to go down the supply chain. You just need to look at national GDP statistics to know what an important block the SMEs are. So for climate, two incredibly important things at both ends. First of all, the negotiating power of SMEs to come together and actually direct the mobilization of the necessary policy, regulatory and legal frameworks that we need in place domestically in states that are in transition in order to make this transition work in a way that it doesn't destroy the economy by destroying SMEs, number one. Number two, the just transition for the workforce. Over 75%, in some countries 90% plus of the workforce is employed by SMEs or are SMEs. They're not even employees, they're small business owners. So it's that just transition for those employees or those business owners that is everything. So actually, I don't think SMEs should be part of the conversation. I think SMEs should be leading this conversation because that's what it's about.
Thanks, Wendy. Josie.
Yeah, I mean, I think it's fantastic. Example in Spain, I know there's something similar in the UK. We're part of Staffordshire Chamber of Commerce and they are engaging with businesses in a similar way. I think the point, though, about sustainability generally is, I know we're talking about carbon footprint and things like that, but we can't have a carbon footprint tunnel vision. I think the opportunity with small to medium businesses that can't do their carbon footprint because they don't have time, the point is you can start with just switching your lights off. I know it's really simple, but those really simple steps, I think as a business owner, the world has been crazy the last 4 or 5 years. It's been a challenge. I think there's things coming that, I mean, we used to have, you'd have an issue every 6 months. Now the big issues are every month. And I think then you've got climate change, you've got sustainability on top of that. It can feel quite overwhelming as business owners. And I know other business owners I've engaged with have said similar. But I think the point with sustainability is it can start today and it can be something really easy and really simple. It doesn't have to be a carbon footprint analysis that is about everything. It can be, what are we wasting in our business? What are we throwing away? What lights do we have on? And that then opens up the next step, which might be looking at what cars are you driving and how long, can that meeting be a Zoom meeting? So I think there is a fear with small and medium businesses. It's a really big project. It is a big project and there's lots of complexities, but it's the baby steps at the beginning. And I think that's always been my takeaway with sustainability. It's the start. It doesn't mean you're going to finish overnight.
I think that's quite a nice way to end. Keep it real. Luke, congratulations to the ICC. As I say, first ever MSME Day at a COP. Well done. This is a really important voice. Thank you all for coming. And thank you to the panelists.
Thank you. Thank you.
I knew 15 minutes wouldn't cut it.
So, here we are. Welcome, ladies and gentlemen. We are honored that you can join today's panel, where we are going to discuss the challenges that climate change is imposing on human health on this warming planet. We've heard that temperature has risen by 1.4 degrees Celsius, so just below the 1.5 degrees Celsius threshold. And it comes with a huge burden on human health. So the data are very, very undoubtful in this regard. And we can see that heat in particular imposes a high disease burden and a high toll. So we see that in Africa, around 12 to 19,000 children are dying of heat every year. We've seen that in Europe, in the heat waves of 2022, more than 60,000 people have died of heat-imposed disease or incidents. So COP28 has for the first time listened to the global health community and established a health day, which we very much appreciate. The ministers of health come together for the first time. We are expecting a declaration on climate and health at the end of the conference. But I think it's fair to say that this is just the beginning and that we should embrace this opportunity to take action jointly amongst all stakeholders that are convening here in Dubai this year. And there's a lot we can do. And that's what we want to discuss today with our esteemed panelists, with our Bayer CEO, Bill Anderson. And I would just like to raise a few topics where Bayer as a company is already pretty active at the intersection of climate change and health. We are one of the leaders worldwide in fighting neglected tropical diseases. We have co-signed the Kigali Declaration. We are leaders in fighting Chagas disease in the Americas. We have just agreed upon a partnership with Fiocruz, one of the leading public health institutes in Brazil and on the continent, by the way. We are developing, together with the Swiss Public Health Institute, a new treatment to fight river blindness. And we have also agreements to help scientists find effective treatments against malaria. So vector-borne diseases are a big issue, and these diseases will be spreading over time due to climate change. But oftentimes we only think about the direct impacts. There's way more indirect impacts that climate change has, one of them being migration. The World Bank estimates that 140 million people are displaced due to climate change. And as you can imagine, it's oftentimes the most vulnerable on this planet, and oftentimes it's women. And we have a vetted interest in helping women on this globe because we have made a pledge to support 100 million women gaining access to modern contraception annually by the end of the decade. So we're working with international institutions such as the Red Cross, setting up humanitarian aid centers and healthcare service centers to provide sexual and reproductive health services along migration routes, for example, in Latin America, helping thousands and thousands of women. So that gives you an idea of what the issue is. The data are pretty clear in that we have to take action jointly and we have to do it together. So before we go into the panel discussion of today, I'm very pleased that Bill Anderson, Bayer's CEO, and also the Chief Sustainability Officer, is joining COP28 today. And Bill, I'm very much looking forward, as the audience does, to your keynote speech and to your insights in what role Bayer is playing and can play in tackling the issue that come with climate change. Over to you, Bill. Thank you.
Well, thanks very much, and thanks to the panelists and to all of you for joining us, and for those of you that are online, Yeah, we appreciate your participation in this session. I'm very happy to be with you all today and happy to share some ideas, but especially to hear from our distinguished panelists. As you may know, I took over as CEO of Bayer in the middle of this year, and I'm new to Bayer, but it's a company that focuses on two basic needs. And these are things that matter every day to everyone, which is health and nutrition. So in addition to that exciting task, I was really excited to join a company with so many great people that are dedicated to a mission, which is health for all and hunger for none. And so many people know Bayer for our role in medicines and health. What a lot of people don't realize is we're the largest provider of inputs to the agriculture sector. So we play a key role in putting food on the table for the 8 billion people of the earth. So it's a bold mission we have. It's unattainable, but it's something that we're inspired to pursue every day. And for our 100,000 employees, it's a daily reminder of why their work matters. And so some examples of this: securing harvests, making our food systems more resilient to climate change. And we're doing this with innovations that we're launching right now, like short stature corn, which has important environmental contributions, as well as direct seeded rice, which has the potential to cut the emissions of methane from rice farming, which is a major source of agricultural methane production, by 90%, as well as saving water. So that's an example on that. In terms of mitigating health impacts of climate change, as Klaus mentioned, we have partnerships to fight malaria, to fight Chagas disease. We've developed one of 2 available treatments, and now we're working really hard to make it available to more people in need. And then finally, securing access to nutrition, to nutritious food, and to self-care for people, because that's an important element, especially in low and middle income countries where there's not always going to be a healthcare professional. And so having access to consumer health products more broadly, as well as nutrition. So we're working hard also to fight our own contributions to climate change. So it's not just what we're doing, but it's how we're doing. And this is an important focus for us. So I think our panelists are aware of this, but for the audience, climate change and health are inextricably linked. And we know, for example, 127 million more people were experiencing moderate or severe food insecurity as a result of climate change in 2021 compared to the previous 3 decades. And let's face it, things haven't gotten better since 2021. If anything, they've gotten worse with war and other disruptions to the food chain. Life-threatening diseases are spreading rapidly due to these extreme temperatures, and heat deaths, as Klaus cited, are up by 85% actually since the 1990s. So we've got a lot to do. As a company, we're working, as I said, on reducing emissions, but we also want to point out that healthcare is inextricably linked to climate change because, for example, we're talking about the global south adopting renewable energy, but that's not going to happen if basic needs aren't being met. You can't really expect a country that can't provide basic health care to be very concerned about generating greenhouse gases. So we've got to do more to solve the critical healthcare needs of all the world if we want to expect to have everybody as part of the work for fighting climate change. So with that, I don't want to take any more time away from our panelists. Really excited to hear from you all, and I wish you all a great COP28, and we continue the fight together. Thank you.
Wonderful. Thanks so much for your time, Bill, and for those insights. As mentioned, we have a lot to talk about, and I would like to introduce you to our esteemed panelists that we have on stage here. Starting from the very left-hand side, it's Dr. Sally Uren, the CEO of Forum for the Future, actively involved in sector-wide collaborations and in one-to-one work with leaders in business, including Target, Olam, M&S, and Bentley Motors, for example. And you assess the potential and reality of regenerative businesses. So welcome to the panel. I'm glad we have you here on stage. Thank you, Sally. To my left, we also have Her Excellency Toyin Saraki, who is the founder and president of the Wellbeing Foundation Africa. We've met so many times virtually. Finally, we made it in person, and I'm very pleased to see you here. With your foundation, you focus on delivering action for maternal and newborn rights in particular. And among other positions, you also serve as a founder president of the Maternal Monday campaign, an advocacy campaign of the Wellbeing Foundation to engage in global conversations on solutions to the high maternal, newborn, and child mortality issues we still see on this planet. Thank you for being here. And in the center, we have Dr. Naveen Rao here with us, who's the Senior Vice President of the Rockefeller Foundation, where he leads the foundation's efforts to shape the field of climate and health. Dr. Rao previously led the foundation's COVID-19 pandemic efforts. It must have been a massive task to complete, including the Global Vaccination Initiative, which really helped increase vaccination rates in low and middle income countries. And you also headed up the foundation's pandemic prevention initiative in the aftermaths of COVID-19. And previously, you've also worked for a company that...
I'm trying to keep a straight face.
Yeah. Where you were engaged in the Merck for Mothers program. I have to say it because we also have a huge interest in helping women in LMICs to really strive for a better life and to really thrive. So welcome to you all. Without further ado, I would like to go into the first questions. Toyin, if I may ask you, let's talk about people. So people that are being impacted. What do you think are the most significant health impacts that you can observe with your work in your region with different groups, be it children, be it women, be it smallholders or others? What do you think is the biggest challenge that comes with the climate change at the intersection of health?
You know, first of all, Klaus, let me say thank you to Bayer for opening this conversation, because this is the very, very first health day we're ever going to have at COP, and you're being extremely bold in also opening that conversation on the effects of heat. Now, from a Nigerian perspective, what we are seeing is that heat is not necessarily being measured. In fact, at the moment, it's only being measured at airports. It's, you know, by the meteorologists at the airports. It's not being measured from a heat perspective on health. But the effects of heat on health are most keenly felt on pregnant women, newborn babies, premature babies in NICUs, and then the elderly and those with underlying comorbidities. And we are actually calculating that if we don't take concrete actions to actually tackle heat where it matters most in the lives of the people, in 3-4 years from now, we will be losing far more than the 12 to 19,000 people we lose each year in Africa. And I think the whole of Europe together lost maybe 60,000 people in 5 years, but we are losing 19,000 every year. So the question is, how does this affect people in their day-to-day lives? And do they recognize this as heat-affected ailments? There's air pollution, there's respiratory conditions, there's cardiovascular conditions, but the heat is always around us in Africa. So people don't always recognize that it's the heat that's contributing to the deleterious effects. I think if we really, really are going to tackle this at source, we have to match the education and the information with the heat measurements, actually. And then, you know, I have to say, it affects women and children the most. And that's where the gender lens comes in. And when you begin to see where is the women's leadership. If I was to pick the one thing I would love to do, it's to take the heat measurement away from the airport and take it to a community led initiative where in communities we can have one person in each community actually measuring the heat. And the effect of heat is not just on health, it's also on their nutrition, their security, and even conflict and peace, because a lot of the conflict you see in Africa is actually around agriculture, the availability of food, the availability of clean water, the availability of water to feed livestock, and the availability of water for lives itself in humans. So I think that as we're opening this conversation today, we're also opening a new, very honest paradigm. We know it's not going to be easy work, but we do know the challenges around us, and we believe very strongly at the Wellbeing Foundation Africa that the intelligence lies within communities. The intelligence will be sustained by those within those communities, but it does require innovative partnerships. You know, I mean, Naveen is here, and I'm sure he might mention later. When we wanted to tackle maternal morbidity, we did so with a very innovative partnership called the Every Woman, Every Child, where the whole world coalesced around Ban Ki-moon, and in each country, we were interpreting it in a contextually appropriate way for ourselves. Certainly in Nigeria, I led that effort, and we dropped mortality by 35% in pregnant women and children. It's still not enough. You know, we still, a country of 216 million people, 35% sounds really large, but you have to think of the other people who are unmet. So this particular COP, I'm calling for very big investments. First of all, we know as Africans, we have to stop burning and cooking with fossil fuels. It's unfortunate that some of our most delicious meals actually come from being smoked over a fossil fuel. But, you know, this speaks not just to air pollution, but even also to preeclampsia in pregnant women. We are seeing statistics that show that women in West Africa and Aboriginal women, in other words, the people who cook with coal indoors, have much higher rates of preeclampsia than other people of, let me just put it bluntly, black genealogy. So we have to begin to look at behavioral patterns. We have to educate around that. We're going to need the whole world to help us with the data, but I'm just really happy to be here and tackling the most difficult conversation on the very first health day, because that's how we're going to get to zero emissions that we want to get to for our health.
Wonderful, thank you. Listening to Her Excellency Toyin Naveen, you heard that there are initiatives on the way that obviously have a significant impact on health outcomes. You've also heard a pledge for more community-led efforts for people to solve for heat-related issues. What do you think are the biggest challenges in the years ahead of us, especially when you think about upscaling solutions in those countries most effective and for those most vulnerable populations?
Thank you again, and I want to add my thank you to Bayer. It's really, truly right time, right place. You're living the adage, you can do good and do well. And so I really congratulate Bayer, and I appreciate it. So I'm going to pick up all my talking points from Toyin, as I usually do. She has left so many openings that I can address, and then I will pick up what you said. So Toyin, you're absolutely 100% right. I've known you for all these years, and every time you speak, I realize how focused and how committed you are. By the way, on the side, and this is not part of my points I was going to make, but talk about commitment, and this lady is committed. I met her 2 days ago, and she was here, and then was going back to Nigeria for 4 hours. And she went, 18-hour trip, and today I found out the reason she went was because it was her granddaughter's birthday. So if somebody takes an 18-hour flight for a 4-hour birthday, that's commitment. And that is this lady, so thank you. But on a really, the note that couple of things. So first is, Toyin talked about measurement. Let me put that in perspective, and now I'm putting on a bit of my medical hat. But it's not just, heat is not just temperature, and we're staying with heat for now, and then if you need, we can go to infectious diseases or wherever we need, or air pollution. But with heat, it's not just the temperature, and I agree, in Nigeria and other places, nobody's actually measuring the temperature, but it's not the temperature that's important. It's the wet bulb temperature that's important. And the wet bulb is basically the ability of the body to sweat and cool. And if the humidity is high, your body doesn't sweat. So wet bulb, there is a limit beyond which you actually cook your proteins and you cannot live. So this wet bulb is really important. So it's not just important for you, the community, to measure temperature in absolute terms, but actually to be able to measure it in wet bulb. And there's a very easy way. You put a wet cloth around it. But I would love the community to be able to understand how important it is to know the wet bulb, because if humidity is high, along with temperature, your kids should not be playing outdoors. You should not be working if you can afford it. So one is on the measurement. And I really want to start changing the paradigm to wet bulb and everyone understand that concept. The second is, yesterday, Prime Minister Mia Mottley reminded me of a very famous reggae song. And the lyrics to that reggae song says, it's hot, it's 96 degrees in the shade. And that is the song, and it's actually a reggae song about the Brits coming and they're trying to say, it's hot here, be careful in terms of political. But they use 96 in the shade, saying it's hot. Today she says 96 in the shade seems cool. That's how it has changed in the last 20, 25 years. So heat, measurement, numbers, temperature, data is absolutely important. I really do want to say that. The second is, even since my medical school days, there is so much more we understand on how heat actually kills people. And we know heat is killing people. And finally, they've understood that it is through kidney disease. So when we were going to medical school, there was traditional kidney disease. And we knew what caused kidney disease. Now they're calling it non-traditional, NT, non-traditional kidney disease, but it's basically acute kidney disease. So if we know that, we need to make sure we do enough research, and this is where companies like yours, Bayer and all, come into play. Is if we understand the pathology, the process, can we do things to prevent it? Can we do things to treat it properly? Because if we don't know what the problem is, we're throwing the whole treatment paradigm at the patient. But there is a lot of advancement, and I would suggest that Bayer look into that. We did a report recently. If we look at the temperature, we came up with a report that looked at 150 different paradigms, and there were 3 scenarios. There is it's like Goldilocks. There's the perfect scenario, and then there's where we are headed, and then the worst case scenario. And by the way, the perfect scenario is already not acceptable. You're saying we're already at 1.4. We probably will end up at 2, 2.5, 2.8. And that is the good kind of scenario. Obviously, then there is where we are headed in reality is 2.8, and then if anything worse. So it's not just human health, it's animal health, it's plant health. It affects heat, affects everything. And so if we don't get this right, so I'll stop here, I'll address any other questions you have, but this measurement, making sure the community is aware of it, and being able to understand the science and pathology to be better prepared for it is the way out.
Yeah, as you mentioned, Naveen, there are indications such as Mesoamerican nephropathy, where you have smallholder farmers or farm workers significantly exposed to heat and humidity who show early kidney damage. So these are the things we also try to understand as a company, where we work with scientists to better see what the mechanisms are. Sally, we heard a lot about where to measure, what to measure, but the question is, what do we do jointly? So when you think about partnerships, what would be ideal partnerships to tackle the challenge that could ultimately make healthcare systems more resilient? What do you think?
I wish I had the perfect answer to that question. But I guess I'll try and answer the question through the lens of the work that we're doing at Forum for the Future on climate and health. So I am Sally, I'm the CEO of Forum for the Future. We're a sustainability non-profit working internationally. And one of the projects that I'm very involved with is the Climate and Health 2019 that private sector action on net zero was really gaining traction, lots of net zero commitments being articulated, but nobody was talking about health at all. And it really became clear, apart from actually there's one of few companies, and some of them in the audience today were actually very early on that journey of understanding climate and health intersection. But actually, if you go outside of healthcare, then the connection between climate and health is not as obvious as it could be. And it seemed to me that we had an incredible opportunity within the private sector to really nudge organizations to, when they're thinking about net zero strategies, also think about health. And so I'm also really pleased that today is the Health Day. We've been trying to make the case for a Health Day at COP now for 2 to 3 years. And so I'm here today really because we're launching a toolkit through the Climate and Health Coalition, which is a build out from the guidance that we published in Sharm el-Sheikh last year, which speaks to the role of the private sector. So we're a non-profit. We therefore have the ability to bring private sector actors together on a pre-competitive basis. The Climate and Health Coalition is supported by Bayer, so thank you very much, alongside 5 other private sector actors. And we've been really trying to do 2 things: make the case for change, which is what we've just heard so eloquently here. But absolutely, Klaus, once people make the connections, then what actually do I need to do? And so today, the website is live. I did check this morning. We've turned our guidance into a digital toolkit so that healthcare actors in the first instance in the private sector can start to really understand how to create the connections between climate and health. And I think the private sector has an incredible role to play. I think through access to goods and services, and in fact, we've just heard that from Bill, what you're doing at Bayer, but one of our partners in the coalition, Walgreens, has a US healthcare project bringing healthcare to underserved communities within North America. Then there's the training and education piece that the private sector is good at. One of our other partners in the coalition, Haleon, doing lots of work with community workers around oral health, for example. And then the really big one, obviously, private sector has access to capital. And I think this is where there's huge potential for private-public sector partnerships, both through funding research. So back to Haleon, they've been funding the Clean Breathing Institute, but also then looking at community investment. Boston Medical Center has invested, I think, $7 million in community strengthening access to food, because, of course, the climate and health agenda is also a food agenda. And that's also why I think this COP is so important, because here we are talking about health, but actually if you can find your way to the food pavilion, and I think you might get a little badge if you do that because it's a little bit complicated out there, we're talking about food as well. And the reality is, in order for us to respond to our climate emergency, we also need to look at health, we need to look at access to food, and that's what our guidance is really designed to do, is to say to the private sector, every net zero strategy that you conceive, push it a bit further, talk about health. Every health and well-being strategy that you develop, talk about climate.
That sounds very, very powerful, Sally. Thank you. Thinking about the 1.5 degrees Celsius threshold, is that something companies, private sector partners are talking a lot about? Or?
Yes, a lot. And I would agree that I think the reality of us staying below 1.5 degrees by the end of the century is quite slim now. But I would say every 0.1 degree centigrade rise is worth fighting for, because these impacts are exponential. And it was really the focus on 1.5 degree that really generated those initial conversations about climate and health, both in terms of mitigation and adaptation. So if you're in the private sector and you're looking at mitigation, then you can decarbonize in ways that has really positive impacts on health through removing air pollution, through encouraging active transport, just encourage employees to take active transport. Big tip for the environment, big tip for your health outcomes. And so the focus on 1.5 degrees is allowing these conversations around mitigation in a way that decarbonizes, drives health benefits. But critically, and we've heard about this already, it's not just mitigation now, we need to talk about adaptation. And that's where there's such huge potential through some of the work that you're doing, through others in the regenerative agricultural space. So investing in soil health, means that we can improve ability to sequester carbon, we also know that improves nutritional quality of crops. And so the focus on 1.5 degrees allows us to talk about mitigation in ways that drives health and climate impacts, but also adaptation in a way that builds not just climate resilience, but health resilience. They are the same thing. When we talk about climate justice, we're talking about health equity. And again, it's why it's so brilliant that you're hosting this conversation today, because the sooner we solve for climate and health together, the greater our chances of drawing systemic change in both of these big challenge areas.
Wonderful. Thank you, Sally. And you already have given us the idea that it's just way beyond of talking frameworks or abstract numbers. When it comes to the question, how do we get innovation or solution to the individuals? Naveen, what do you think is needed to make sure that as many people as possible can benefit?
Thank you again. To us, the way we are seeing it from the Rockefeller Foundation perspective, first thing is the foundation and the president has made a commitment that all what we do over the next 3 to 5 years will have a climate change lens. So we will not work in any, so we basically work in food, energy, and health, and innovative financing. But that we will do everything we do and have pledged $1 billion over the next 5 years to look at climate change in food, energy, and health. Within that, the health team has said we will invest $100 million over the next 5 years to make sure that we look at it. And how we're doing it is we want to go back again to what Toyin said is community-based solutions. We want to hear what the community-based solution is. Yesterday, the minister from Malawi said we need one plan, one budget, and one measurement and evaluation. Currently, what happens is everyone goes in and does their little bit, and the health minister has no idea. She's saying, let's have one plan, one budget, and one accountability. So we want to work locally with solutions based on what the local solution, because the problem is there, the solution is there. We just need to have the humility to work with them. That's what we want to do. Second is we want to bring more financing, and we want to use our convening power and bring partnerships and more money to go to the right places at the right time and make it easy for the countries to access it. And the third is to advance the field and build the stories and make climate health human. So yesterday I heard a remarkable, I haven't checked it out myself, but apparently if you go to Google and type in climate change, there are about 25 images you'll see before you see a human image. There are polar bears, there's fire. I mean, when you say climate change, it takes about 25 images before somebody has linked a human to climate change. And that has to change. So we want to do that. Solutions, financing, and stories to
May I
make it
just
real.
come in there? Because
Absolutely.
actually there's a great campaign that's launching today called the Face of Change campaign.
That's what I heard.
Yes, and at the Climate and Health Coalition, so that means you at Bayer have been supporting this because it's absolutely designed to bring the human face to the climate story. It's an incredibly visually powerful toolkit, launched last night, lots of events today, and it's really about bringing the human face to climate. And that's got two benefits. It means that climate then becomes a relatable topic, but also in a deeply politicized world, it means that we can sidestep that polarization caused by the phrase climate change in some parts of the world. Going in on the health message often means that you can then move into a much more neutral, solutions-oriented space. So check it out, the Face of Change campaign. It's amazing.
And it's Time Magazine, that's where I heard this. And truly, if you tell people your child has asthma because of air pollution, is a different story than it's not Republican, it's not Democrat, it's not political, it's real. Versus the word climate change that involves fossil fuels, that involves loss and damage, that involves colonization, all that baggage to sidestep it. Health is probably the way we can do it. So I agree. Thank you.
And Toyin, through the lens of perhaps underserved or underprivileged women, what would it take?
Gosh, it's really going to take a lot. First of all, we have to look at women's leadership. Then we have to look at women's access to financing. We have to look at women's access even to farming, you know. I tried many times to encourage women farmers, but the obstacle was always women's ownership of land. And then when I even look at women and children's access to health, and then I have to be honest and look at our own health-seeking behavior and our own, I don't want to call it behavioral change yet, but as an African woman, if I was to really ask for my ideal solution, I would say that I do want the solution to be at a primary level and a community level, but I don't want the solution to be what used to look like the PHCs that we used to have before, because I think the reason they haven't been successful is because they are flawed. If I'm a sick Nigerian woman, you know, I wake up and I have a terrible headache and a fever and it's very hot outside and it's humid and I feel I can't breathe, you would be surprised to discover that I wouldn't go to a hospital. I would first go to the nearest pharmacy or the nearest patent medicine seller, which would be quite close to my house. So I guess it's like going to Walgreens. And then if they gave me medicine and I didn't feel better, I would go back to that pharmacy. So it's in my neighborhood, and probably ask for a test for malaria or typhoid if I've ruled out being pregnant. And if I still didn't get better, probably when I pass out in the middle of the night in a lot of pain, I would be rushed to the nearest primary healthcare center. But by this stage, I would be an emergency patient presenting at, you know, what is very, very basic. So what I would love to see to improve women's access to the right nutrition, the right entrepreneurship, the right leadership, the right food, the right business farming, the right health, I would like to see a community-centered type of development hub where you would have a pharmacy, you would have a comprehensive community clinic where everything could be dealt with there. You would have greenhouse farming, you would have people growing superfoods. 25% of Nigerian women have anemia. And out there somewhere is a bio solution that could be added to tomato paste. And we all cook what we call red stew every day. If this was added to tomato paste, we could wipe out iron deficiency, anemia in my country in 1 year. But it's been researched, but it's not ready for go-to-market. And there is no domestic resource mobilization. So this is where we begin again to look at the rest of the world that already has the innovation. They already have the wind farms, they already have the solar inverters. And is there some way we can bring this to a community level and make it digestible at a community level? Because the other thing that we do have to be honest about is that where it comes to our underprivileged people, when the solution looks too swish, they are scared of it and they think it's too posh for them, or they think it's unaffordable and they don't even come in the door. So it needs to be hi-fi, but it needs to look friendly. And I think the solutions are all around us. I've been watching what Bayer is doing with soil science, and very excitedly, by the way. And I just think that we could farm soilless and hydroponic plus soils. We could do it all in one place. In the olden days, farmers would have one field that is being tilled and the other field that is being rested. In the front of that field would be a farm store selling the produce, and whatever could not be sold quickly would be dried. An easy way to measure community development throughout Africa is to ask the community how many market days they have in a month. A community that has market day every day is well on its way to progress. That community has enough entrepreneurs, they have enough drive within that community to drive their own development. So they're probably ready for second level development. But many, many communities have a market day only once a month. And that's because they don't have the power to preserve their produce. So usually how you know there's a community like that somewhere nearby is you're driving on the road and you see little piles of dried red peppers. And if you were to stop, somebody will come out of the bush and say, do you want to buy the dry one? So what we need is to merge all the knowledge we have. We know the challenges, we know the dangers, but we do need, I think it will be driven by power. If we can sort out clean energy and then put that innovation behind our health, our agriculture, our supply chains, our measurements, it really can be done. And Naveen, I keep looking at you because this is going, it's a risk that it's going to take bold partners to do things differently, not just do it the same way they've been doing it before, and to harness the local knowledge, match that to some global solutions. And I'm pretty sure it will work. We've taken such risks before, and they have worked, but it's going to take a massive investment.
And you initially referenced some of the good outcomes of the Every Woman, Every Child initiative you've had. Thinking about the many different aspects of getting to this outcome, has it been easy to prioritize, to assemble people behind a certain goal? What can private sector do? Sally, perhaps you also want to chime in. So how do you get to this point where you come to the table, define the path forward, and take action?
How we get to the point is, first of all, we have consensus. I think in this very room today, we already have consensus that something needs to be done. And then we begin to pull in the partners. Like Sally said, it's taken us 3 years. I think it was Glasgow where we first mooted that we needed to have Health Day. And at that time, everybody thought it was 10 years away. But here we are 3 years later. We have achieved Health Day. It's now up to us to stop the talking and begin to marshal the partners and marshal the investments. And I do want to say to what I would call the rest of the world, these aren't necessarily new investments. When I sit in a room with a partner, I look at what that partner is doing already, and then I look at what I can ask that partner to extend in the direction of the regions that I'm working in. So for instance, in 2018, we saw a statistic that showed that only 22% of Nigerian healthcare facilities had water and soap in the labor room. And that's why I understood why all our midwives were asking for elbow-length gloves. But since then, I think we have reached over 233,000 midwives and the mothers that they deliver with clean soap and water and hand washing practices. It's now extending to schools. It's now even extending to surface science. What was the original goal for that? It was to stop maternal sepsis. What have we achieved? Huge behavioral change. They were laughing at me actually in Nigeria when I first started hand washing all over the place in April 2018. But when COVID came along, I had people from all sectors saying, could you please send us that, your hand washing video? We need to know how to do it again. So to get the partners in the room requires a commitment. You walk into that room knowing that you want to commit, and then you commit smart. I think that's really what I want to say.
And then what I would add to that, and just picking up the point you made about doing things differently, is I think we need to recognize we do need to shift in our approach. I think we're at the stage where it's not just the what we do next, it's how we do it. And Klaus, when you did your kind introduction, you talked about the fact that we at Forum do a lot of work on what we call just and regenerative business. We've created guidance. We love guidance and love frameworks at Forum. But what we also discovered through that is actually the biggest leverage point to drive the transformation that we now need to see at the scale and the pace is actually our mindset. It's the stories we tell ourselves, it's the narratives, and just a few of those shifts from saying, what's the risk here we're trying to manage, to what's the potential we're not seeing. That's how I got interested in climate and health, because I saw a potential to decarbonize that also drove benefits for health and for the food system. The other shift is from what our communities really need is ... And you both have talked about this, is how do we co-design solutions with our communities? Another shift, our experts have worked out the solutions to actually lived knowledge, lived experience is really critical. And there are all these shifts in our mindset that mean that we can suddenly start to see potential and recognize we don't have all of the answers. And most critically of all, I think my message for this COP is we've got to lean into extreme collaboration now, extreme partnership. Within the health system, I'm struck by the fact that the multilateral agencies don't really trust the private sector. Philanthropy hasn't really unlocked in the way that it could do, so no pressure there. But we just really now need to work across the healthcare system and then outside of healthcare, because there's a limit to what we can drive in terms of health outcomes without transforming food, without transforming mobility. And so for me, this COP is, I hope it's all about that outrageous partnership, both within the healthcare system but outside of healthcare, asking how do we unlock all of the assets that we've got? We've got the capital, we've got the knowledge, we've got the tools, we've got the techniques, shift our mindset to from what's the risk we're trying to manage to what's the potential here. So shifting mindset, I think, is the next big challenge, and we can all do it. And I was saying to Bill at the beginning, what happens next, I don't think will be a technological story or a finance story. It will be a human story. It'll be whether or not we can shift how we do things. And if we can, then we might be at 1.53 by the end of the century, but that's a hell of a lot better than 4.
Wonderful. It's great to feel the energy here on stage, I have to say. And Naveen, if you think about this energy, and if you think about the many policymakers that will be around this venue and that you will also meet in the future, what would be your advice to policymakers? How can they advance all the activities? How can they unleash the power that you see with these partnerships emerging? What would be your advice?
The bad news is climate change kills. The good news is it kills equally. It doesn't matter if you're rich or poor, the air you breathe, you may be as rich as you are in certain cities of the world, but your child and you are breathing the same air. So it's come to the stage where policymakers, as Sally said, we need to make this human, need to make it connect that this is not political, this is not happening somewhere in the world, this is at your doorstep and your children.
Thank you. That's very insightful, and everything you just said resonates very tangibly here with the audience. I see a lot of nodding in the room. Also in the interest of time for today's panel, I also really want to make sure that our audience and visitors here would have the opportunity to ask questions to the esteemed panelists. So I would assume I'd just go by myself here. Just briefly introduce yourself.
Yeah, sure. I'm Hatice Beaton. I'm the Executive Director of the G7 and G20 Health and Development Partnership. So speaking about behavioral change, since 7 years, together with my chairman, Alan, we've been creating a structural dialogue between health and finance ministers on the G20 level to talk about the ROI and the return on value case for investment in health. So listening to you in the panel, we have conducted a study recently on sustainable finance in health. And of course, as opposed to climate change, in health it's harder to measure and attract investments from asset managers. There was a lot of dead valley and misalignment between the health community and the finance community. However, what we realized is actually during the pandemic, there was an 11-fold increase in health investments. So when we speak about the investor community, there is appetite. But the missing link here is the political messaging and will by health and climate change ministers going forward that they have to speak the common language. So my question to you is, do you think in future sustainable financing for health and climate change, we should be triggering multilateral development banks to remodel their grants and loans to increase catalytic funding and increase the political will between health and climate actors? Because that's missing right now. Would like to get your take on it.
I'm happy to start. One of the big leverage points that we've identified through our work in the Climate and Health Coalition is the investor community. And there is some work happening right now to understand what's the equivalent of a sustainability bond, but for health. So we know that, well, for example, Klaus, you mentioned I do a lot of work with Olam. Olam Agri have got a $2 billion loan from HSBC, which is geared to how quickly they can decarbonize. What happens if you layer in health into that? And I think we're getting a lot closer to understand what that could look like. So in other words, you get a discounted rate of return according to health outcomes. I don't think we've got time to reimagine capitalism. I think what we have to do is to use economic instruments that are proven, that are out there, to allocate capital, actually to allocate capital and divert capital away from subsidies, away from those industries that are contributing to dire health impacts, also climate impacts, and actually harness that capital to really allocate towards positive health outcomes and climate adaptation. And I think we're really, really close. So I've already seen a prototype of a sustainability bond that's got, it's not just E, S, and G, it's E, S, G, and H. And I think once we unlock that, then we unlock flows of capital into driving positive health and positive climate outcomes. So I've realized I'm feeling quite optimistic today. I don't know how long it will last, but I think until we articulate those instruments, we're not going to go fast enough. But I think we'll start to see quite a lot of momentum in this space.
Thank you, Sally. We have one more question from Judith.
Thank you so much. Judith Arenas, APCA Worldwide, and I co-chair our gender practice. So I want to build a little bit on intersectionality, and I don't want to dampen your positivity there, Sally, but I love the comments and the remarks that were made earlier, especially yours, Your Excellency Toyin, about the experiences that you gave us. And I wanted to pick up on 2 points. So building on the intersectionality piece, I wanted to ask if you could build a little bit on the research piece and the data piece, because I think something that worries me a little bit is that, you know, we have the climate scientists talking here, the health scientists talking there, particularly when we're talking about women's health that we know is deeply affected, when we're talking about global warming and temperatures rising. You gave us wonderful examples of how that is impacting on childcare and maternal health. Menopause is already something that we know gets impacted with rising temperatures. Would love to hear about that. Someone made a comment about where are the scientists in all of this. A brand newcomer to COP said, you know, this is a deeply scientific conversation, and they weren't seeing scientists around. So we'd love to talk about how do we bring these experts communities together, but then how do we bring disciplines together as well to just improve on outcomes?
Thank you.
Happy to just, again, very quickly, I'm sure my esteemed panelists would have more to say. But actually, I think what is amazing about this COP is you have got the scientists here. I mean, I'm an environmental scientist, but you've also got the healthcare practitioners for the very, very first time. And in fact, one of the drivers behind the Face for Change campaign that I mentioned a moment ago is we have got a lot of the data. The case for change to act on the intersection of climate and health has actually been very well made. It's been monitorized in terms of impacts on capital markets. It's just not well known. And so, for example, in the Climate and Health Coalition, we used malaria, food, air pollution as the way to kind of wake up private sector actors that these issues were connected. But you still speak to people, say, in tech companies, and they haven't made that connection. So a lot of the data is actually there. It just hasn't been amplified in the way that it needs to, which is the high dream for today, having a health day, is to really start amplifying and upweighting that information, because it does exist. You do have scientists working with practitioners. We just haven't quite elevated the conversation in the way that it needs to happen.
I'll just add to what Sally said. I completely agree. And a glaring example in our own lifetime is tobacco and lung cancer. It took 30 years after we had the evidence. We didn't need more evidence. There was a vested interest to keep it going, and the story is playing out again. So I'm not sure it's more evidence, more scientists. It's exactly what Sally's saying. How do we move and break status quo right now?
Well, if I could put my 2 cents in, I would actually like to see a lot more evidence from Africa. You know, each time I want to start a new program in something, I do what everybody else does. I Google, I look for the evidence, I look for the research, and most of the time, that research and that evidence is coming from the global north. And it's not because nobody is researching in Africa. It's because we, the Africans, we don't actually know each other. And we don't have avenues where we can share that research. So most of the time I'm using African Malaria Leaders Alliance, and I'm looking at their PHC data in Nigeria, which is being collated out of Nairobi, because I don't have an open source Nigerian database that I have access to look at. So certainly we need to begin to look at the digital technologies and the sharing licenses or open source sharing, and even on the investment case that you were talking about, you know, with the health economists. I was recently looking at running some PHCs, and there was no way I could make the numbers work for $4 per person per year. And they would sort of, you know, yes, you can have these 350 PhDs and you can run them if, you know, we're going to pay you $4 per person per year. And I looked at the person negotiating and I was like, does your care cost $4 a year? You know, I can't get scale at that. So we do have to come to this table of partnership and collaboration with honesty. And then we have to look at the problems that we have on the ground. If you were to come to me with a solution that can look like a market square, you said something about the challenge being at the doorstep. And I think the solution also has to be at the doorstep. Something that looks like a market square where I can get my health, I can get my food, I can grow a little, I can sort my power, and I can actually also aspire, because we have something we call I pass my neighbor, where the solution to the challenge is not so way past your neighbor that you think it's beyond your reach. It's just that little bit, you know, the sort that bit of curtain twitching, you can see the solution and then you copy it. And I think the solutions are all here. Where we are in Africa was where you were about 100 years ago. And you made it, but we don't want to take 100 years. We want to do it now. We want to do it sustainably. We want to do it with dignity, with respect. And we also want the communities to lead, because we don't want to be building dependencies that will cost us all a lot more in the future. So if there are partners out there, there is no shortage of human faces. You know, you saw I was smiling when you said the face of the challenge. I always smile, because when you come from Africa, every day you go out and you see the face of the challenge. You don't need an advertising campaign to see the face of the challenge. So please come to Africa. Don't keep your solutions to yourself. And then let's actually partner. So this is not come donate a solution. This is let's partner and let's make this work at scale.
Wonderful. Thank you, Your Excellency. A very strong pledge for partnership. I don't know how you feel in the audience or online. I feel like this could go on for another couple of hours with new aspects coming to the table every now and then. So it's been really fantastic to have such an esteemed panel assembling here at COP28, at the first COP28 Health Day. We talked about where to measure, what to measure, the necessity to have the right data to make informed decisions, to have clear tasks ahead of us, clear plans, a clear allocation of budgets, and also ambitious goals. And Sally, I think you made a very, very strong pledge for public-private partnerships, for the private sector to lean in face of this grand challenge. So with this, I would really like to close today's panel, but while we're closing it, I think it's the beginning of a more profound discussion. And I would also like to thank our CEO, Bill Anderson, for his keynote speech at the very beginning of today's session. I hope you have a fantastic stay and wonderful dialogues here in Dubai. And yeah, we look forward to reconnecting and partnering in the not so distant future. So thank you very much for your attention. Thank you.
pick up, but